A familiar scene in a city reeling. New Yorkers applaud healthcare workers from their apartment windows, a small gesture of appreciation for those who continue to risk life and limb to treat the sick.
I'm making this video with my colleagues here in New York to try to help you understand how serious COVID-19 is, to encourage you to stay safe, to stay home, and to kind of give you a better idea of what's going on in New York City, just so you can really take this seriously. Hospitals are running out of medications. Some hospitals don't have protective gear for staff or family members or patients that come to the hospital. We're running out of medications, we're running out of equipment, and we're even running out of oxygen, which is something that patients that have COVID-19 need. So we don't want to test your immune system in this day and age. If you're feeling unwell, stay home. If you're exposed to somebody, stay home.
While bed capacity in the city has been supplemented with the arrival of a Navy hospital ship and the construction of temporary field hospitals, like at this Manhattan Convention Center, frontline workers feel they're operating in a war zone.
Oftentimes, before I start my shift, I have to pray and meditate for at least 5 minutes to get my mind in the setting of going into this war that we're battling, which is the novel strain of the coronavirus. And so, like I said, we're trying to keep our head above water without drowning. We are scared. We're trying to fight for everyone else's life, but we're also fighting for our lives as well, because we're also at the highest risk of exposure. It's tough. And many shifts that I've left from, after finishing my shift, I've cried.
Protective masks and ventilators continue to be in short supply as this and other cities brace for a surge in patients, with New York's mayor indicating that they'll need 3.3 million N95 masks and at least 400 additional ventilators by Sunday.
In a normal time, a gown is disposable after the patient encounter, a single patient encounter. Everything is, the gloves, the gown, and the mask. But we are making gowns last an entire day, and we're making masks last hopefully 5 days before we bring a new mask. And so at the end of the day, the gowns are properly disposed into sanitation kind of bags and sterile, medical waste bags. And then the masks we disinfect, we throw into a dryer under high heat, because that would kill the spores, if God forbid there were any, and then we reuse them.
As the country, this epicenter in particular, braces for an apex in cases in the coming days.
Difficult days are ahead for our nation. We're going to have a couple of weeks, starting pretty much now, but especially a few days from now, that are going to be horrific. But even in the most challenging of times, Americans do not despair. We do not give in to fear. We pull together, we persevere, and we overcome, and we win.
And if New York's iconic landmarks told a story, it would be of a virtual ghost town, a bustling city of over 8 million, reduced to a shell of itself. Times Square, Grand Central Station, Washington Square Park, the city that never sleeps, induced into what many hope will be a life-saving coma. Sherwin Briceby's SABC News, New York.